Hello, I'm Dr. A.S. Puri. I'm Vice Chairman at Medanta, Gurugram, and most of the patients in my practice are related to luminal gastroenterology and IBD. So the commonest symptoms of inflammatory bowel disease is one, abdominal pain. Second, it is a change in the bowel habit. That means it can either be a diarrhea or sometimes it can be a constipation. And the third most important thing that I would like to see here, the presence of blood in the stools should never be ignored. In many cases it might be something very trivial like hemorrhoids or something else, but this is one of the earliest signs of patients with ulcerative colitis, that you start having blood in your stools or you have a bloody diarrhea. And last, please do not ignore any swelling, or specifically it's painful in the perianal region, because it can be a sign or it can be a feature of perianal disease, which is common in patients with Crohn's disease. IBD is, the symptoms are not restricted only to the guts, so it can involve various other organs such as the joints, which is common. It can involve the skin, so you can have painful nodules on the skin, which we call as erythema nodosum, or sometimes it can be something much more severe such as pyoderma gangrenosum. It can involve the eyes, and it can even involve the liver. Now, some of these symptoms come when the patient is having active disease, and I want you to remember the 3 E's. So if you have the 3 E's, then they will come when the bowel symptoms are very active, which is episcleritis, E for episcleritis, E for erythema nodosum, and E for your elbow, which means the arthritis. So in patients who have joint involvement, it can be either related to the disease or unrelated. When it is related, as I said, one of the 3 E's, then it is asymmetric and involves the weight-bearing joints. Otherwise, if it comes when the patient is in remission, then it is type 2 and multiple joints are involved in a symmetric manner. We have 3 goals. One is the early, the intermediate, and the long term. So the earliest goal that we start with, and which is very important from the patient's point of view, is the fact that we look for symptom control. So if he is having a bloody diarrhea, then the first thing he wants is that my diarrhea should stop, blood should stop flowing, and I should be able to sleep at night. Because many of these patients, they have to get up frequently in the middle of the night to pass stools. In patients with Crohn's disease, they also have associated abdominal pain. So their pain is the dominant symptom that we try to alleviate. So this is our the early goal that we try to reach. Then we have intermediate. In intermediate, we have gone beyond the symptom control, and we don't want any relapse to occur. So we want the remission to continue. Once he is, because the drugs that we use, they are both for induction, and then later on, after a period of 8 to 12 weeks, they put on maintenance therapy. So we want these patients to continue in remission for a long time. And the ultimate goal is that improvement in the quality of life and prevention of deadly complications such as malignancy, which is seen in patients who have ulcerative colitis for more than 20 years or more than 30 years. So these are our early, intermediate and long-term goals. Of course, we also, in case of both ulcerative colitis and Crohn's disease, we are also interested in mucosal healing, because if we get mucosal healing, then in those patients, the hospitalization is less, the risk of surgery is much less, and the risk of development of CRC or colorectal carcinoma is also much less. So the warning sign is always either the appearance of pain in case there is an obstructive lesion. In ulcerative colitis, it might be a slight increase in the stool frequency. It can be initially a non-bloody diarrhea, but sooner or later the patient will start getting blood in the stools. And of course, if the patient has been having these symptoms for some time, then he can also have features of anemia, weakness, tiredness, fatigue. And so these are some of the symptoms that would come. But for a flare, we need two things. We need one, increase in ulcerative colitis, increase in the frequency of stool, and second is the presence of blood in the stools. So if you have only one, then this is not a flare, because if you have just blood in the stools, it can just be a simple case of hemorrhoids. And if you have just increased frequency, some of these patients, they get anxious about their symptoms, so it can be an IBS overlap. So for a flare, you need both increased frequency as well as blood in the stools.